Hey guys, this is Jeff with Network Fitness. Today we're going to go over how to get some better benefits with self-myofascial release. Some of you use the rollers on your forearms, using that to work into those muscles on the front side or the back side of the forearm. As many of you know, you got more muscles between these two joints than just about any other joints in the body. You got 19 muscles or so between the wrist and the elbow. A lot of us don't do any therapy whatsoever for the forearms. Some of us deal with wrist pain, we deal with hand pain, we deal with elbow pain. A lot of that stuff can be remedied if we just get the tissue in the forearms to work better, front and back side. One way to make this stuff a lot less painful and actually to work a lot better is to use a compression strap, whether it's the sleeves that you put on from Skins or some other company, or you can actually use something that's a little bit more aggressive, which is this compression strap here. Now these straps do come in 4 different densities. There's a yellow one, a green one, and then the black one is the next one up, and then the orange. You want to use the right density for what your body can handle. You don't want to use a stronger, longer strap than what your body can handle, and these straps come in 80-inch lengths. So if you have a smaller arm, you might want to cut this in half so it's not so much strap that you're wrapping around for days. For the most part, you want to put this on tight, but not so tight that it's painful. So you want to wrap that tissue, squeeze that tissue down, restrict blood flow to some degree, but not cut it off completely like a tourniquet. We're not trying to kill tissue cells down here below the strap. So if you put it on too tight, that actually damages tissue. We don't want to do that. So when you do put this on, putting it on by yourself can be a little bit tricky. So you may want to hold the bulk of it in your hand, that we have a handle on it. Get that wrapped down just a little bit, and then pull this tight with your fingers, and then let go of that and wrap it around. Once you've got that thing on your arm, now you have something to work with. So you're going to overlap the strap a little bit. You can wrap this anywhere between the wrist and the elbow, but you want to stay on about the same 4 to 6 inch range. So you want to work one area, then maybe work this area, then maybe work this area, but you don't want to wrap the whole limb like a mummy. That's really not the most effective way to do this. So you wrap that in a way that makes sense. Try wrapping clockwise and counterclockwise. If you wrap it too tight, you're going to start noticing all kinds of veins are popping out and stuff's going to be very uncomfortable. Take that off, back that down a notch. It might be a little too snug at first. You're going to have to experiment a little bit with it. Make sure it's not so snug that you can't actually work with this. You want to leave it on for about 30 seconds to 2 minutes. That tends to be a good framework of time for the average person to work with this for themselves. If you've got a therapist doing this to you, let them determine how long they're going to put it on. It's their call. They're the ones that are trained in how to work with the body and the tissues, and they know better what to look for if there's a problem. Once you get that down to where it's about 6 to 10 inches left, tuck it in, leave a little bit of a handle there. I wrap this clockwise around my arm so that I'm actually going with the wrist bones, pushing that bone down there and wrapping that wrist kind of solid, but I can still move that wrist and do range of motion. If it's so tight here you can't move your arm at all, that's too tight. You really want to have it just loose enough to where you can take those muscles through range of motion, whether you're pressing, doing a series of push-up motions. You can grab a hold of a bar, do a series of pulling motions, but the idea is to put it tight enough to where it restricts motion but doesn't keep it from happening at all. If you completely isolate this and don't allow any motion, that's bad. We want to have some movement through here. That's the idea. After 30 seconds to 2 minutes, somewhere in that time frame, your body's probably going to tell you, get this darn thing off. When you take this off, if you've done this appropriately, you should feel what's kind of like a waterfall of blood flow through that area. It should feel like all of a sudden there's a rush of fluid through that area. That's what we're looking for. We're looking for this tissue to breathe better. Here, 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 anywhere along that chain. Some of those deeper muscles in the forearms, you just can't get to them with the balls and the rollers until you get better circulation. And that better circulation is achieved by getting some of this stuff to break up. So we put this strap on here, we squeeze that down, but only as much as your body can handle, and we take it off as needed. If it hurts, take it off. If you put it on and you can tolerate it, go a little bit tighter maybe next time. You're going to practice wrapping it clockwise or counterclockwise so you can get different effects from the strap. How you wrap it does make a difference. How tight you wrap it does make a difference. At all times, proceed with caution. You can do damage to yourself if you're not careful with this. But if you do this smartly and appropriately, this works a whole lot better whenever it comes to getting this to loosen up. And then this stuff that you're doing, all of a sudden it's nowhere near as painful. This is far less sensitive when I work on it after doing this, and that's the idea. I want to make these rollers and other tools work better for you for self-care. Good luck in your efforts. If you do it right, you should feel better and better as you do it.